How are you? Good, how are you? Hey, how are you? This is Ignacio. He's
Hi.
learning about the urologist, learning about kidney cancer.
Okay.
So, the CAT scan is pretty much, it's okay. Like I just made images for you again, just in case you want them.
Yeah.
So this is your one from last time. This
Yeah.
is the one from this time. It's exactly the same. Just
Shrunk just like a...
like a few little things, yeah.
Yeah.
And then this is the other one we're following. Well, there's a few, but
Yeah.
these are the two largest ones.
As this kind of is too.
It's about the same again.
It
So
went down like a smidgen.
yeah. So at this point, everything is pretty much, if you read the report, is pretty much exactly the same.
Okay.
So over 4 weeks, nothing's grown, which is not horrible.
Okay.
In general, we think it's actually not a bad thing to be stable.
Okay. So does this mean the IL-2 is not working, or?
No, so it means that we're not sure.
Okay.
So there's a group of people that seem to take longer to respond than others.
Yeah.
Admittedly, it's a smaller group.
Yeah.
But if your disease clearly hasn't grown, after the IL-2, usually we give it another little bit of time.
Okay.
Because we've definitely seen people respond late.
Okay.
When I say late, I mean between 12 and 24 weeks.
Okay.
In that window. I would say most people who are going to respond earlier.
Yeah.
But we still have seen that where
Yeah.
people, it just takes a little longer. So I think because nothing's grown,
Yeah.
I think it's worth giving it a chance to see.
So give it some more time.
Yeah, to see if you're one of those people that are just going to shrink.
So even
in
this
between.
slight little shrinkage is nothing.
Well, I mean, if it's the tip of the slope where
Yeah.
you're tipping this way, then that's
Then that's
terrific.
good.
But there's enough variation in between the images and how
Okay.
they're cut and things like
Yeah.
that I'm not sure
Okay.
we can make conclusions based on
Okay.
fractions of millimeters.
Okay.
I do think it's worth giving it some time and seeing if you're going to your tumors will start shrinking.
Yeah.
And then clearly, if they don't, then we can do other things.
So nothing new though, right?
There's nothing new, and everything
Mhm.
is stable. So it's not we like to see things shrinking.
Yeah.
But at the same time, it's certainly better than things growing.
Right.
So and we've certainly seen people respond later. So I still think it's worth giving the IL-2 possibly a chance.
Okay.
I think just because we do have other things around. Sometimes we wait 3 months. I think
Yeah.
in your case, I would rather scan a little earlier
Okay.
than 3 months, maybe in about 6 weeks.
Okay.
Just to kind of see what's going on.
Sure. Okay.
Because if the things are growing, we do
Yeah.
have other options, and we actually have other options that are both immune